I have this other question, perhaps could be seen as a controversial, but is this not possible among doctors and clinicians to come up with a sort of a United Nations type of agency or some kind of a common agency for the world population? Is it not possible to have a one, approval body that can apply to the entire population, or is this too much of a dream, or is this unreal, or is this?
I think the challenge here is when you look at clinical research, you're working with a set population. And usually as somebody who does a lot of clinical research, usually you have to define your population very clearly. 18 to 65, this gender, this race, this sort of disease. And the problem is when you define it very well, it makes it better to conduct the trial. But it also means that trying to apply the findings of that trial to other populations is going to be more difficult. And so over the years, we've come to realize that clinical research done previously was mostly done in Caucasian populations, male populations between a certain age. And so we were missing out on entities, for example, that present in women differently. For example, if you have heart disease in women have different symptoms. They have a different age group. And so we might miss out on them entirely if we didn't design our trials to address that. So yes, it would be great if if we could reapply FDA approval elsewhere and get instant clearance. But I think because disease looks different across the world, we do have to keep the patients in mind, and we do have to put safety first.
I'm convinced what you said is probably correct, but on the other hand, I fully understand that when it comes to pricing and when it comes to manufacturing and others, there are other factors that should be differentiated, but hopefully clinician can address this issue together, because as a normal citizen, I just want to see medical innovation coming to the market earlier and fast and better. Yeah?
Of course. And I think although the regulatory bodies like FDA are very conservative, they are open to change. And for example, in the past 10 years, as digital technologies and digital health solutions are becoming more popular, they have added on and worked with industry partners and experts to figure out how do we regulate medical devices that are digital in nature. And I think they've been receptive to making adjustments over the years. And I'm really hopeful that in the future, as the world becomes more international, as international collaborations become more common, that this will increasingly be the trend.
Perhaps this may be my last question for today. I do believe properly medically trained clinicians are the one that can come up with a better product in terms of designing and everything else. So we like to encourage more clinicians to turn themselves into an entrepreneur and coming up with the new innovations and all that. So what can we do to encourage them to come into that space?
I think it starts with the ecosystem and sort of fostering that sort of idea that even being a clinician innovator is a pathway, and it's a feasible one and a successful one. Within healthcare, there are many people who take on multiple roles. There are educators, there are administrators, there are researchers, but there are also increasingly innovators. And that you don't need to have an engineering degree or a stroke of genius or some sort of wild idea to be an innovator. All you need is to look at the patient in front of you, find a problem that no one else has solved, and really come up with a solution that you think is meaningful, is effective, is safe, and will really benefit people's lives.
All right, thanks. Again, this topic of how to collaborate between clinicians and innovator is a very tough topic, but today I think we heard a very rare, insightful view from a real practicing clinician, Andrew Chou, to get his input, which I think is very much valued. It's a lot more than Chris Lee talking about his own, biased way of how to work things out. So hopefully this helped you some hint in what does it take to make this thing work. And thanks for listening, and hope that we can carry on this conversation, and we invite any good suggestions and recommendations from any of you.